The primary purpose of this PowerPoint that I made was to inform people of autism, what it is, how it affects people, and how they behave. It's about associated medical conditions that come with autism, and what inspired me was seeing my brother with autism. Genetic disorders affect 15 to 20% of people with autism, and Fragile X syndrome is a genetic condition that causes intellectual disability. Both behavioral and learning challenges and physical characteristics are affected. Males are most frequently affected and have more severe results than females affected. Angelman syndrome is a neurogenetic disorder that occurs in 15,000 live births, and what comes with this are developmental delay, lack of speech, seizures, and balance disorders. Tuberous sclerosis is a group of 2 genetic disorders that affect the skin, nervous system, kidneys, and heart. Tumors are more likely to grow through the body with this condition. Chromosome 15 duplication syndrome is a clinically identifiable syndrome which duplicates chromosome 15. And there are many problems that come with this syndrome, which include gross motor delays, fine motor delays, cognitive delays, speech and language delays, sensory processing disorders, behavioral challenges, seizure disorders, attention deficit disorders, anxiety disorders, menstrual irregularities, weight gain, overeating, and skin dilemmas. Gastrointestinal disorders are disorders associated with the stomach. This is a very common disorder for people with autism, and it affects up to 85% of them. Severity can range from constipation and diarrhea, and issues to inflammatory bowel disease or irritable bowel syndrome. Seizures disorders, including epilepsy, are disorders that affect up to 39% of people with autism. These disorders are more common with autistic people that have an intellectual disability than those without. Most of the time, people with autism that have seizure disorders experience more than one type of seizure, but the easiest to identify are grand mal seizures. Those are also probably the most common. Others include petit mal, which is when someone seems to be temporarily absent, and subclinical seizures, which may only be visible in EEG testing. Sensory processing problems are really common with people with autism, and it means that they have a difficulty interpreting things through the 5 basic senses. They can experience any of this normal stimuli to be painful or frustrating. On the other hand, some people with autism are hypersensitive to sounds or touch, also known as sensory defensiveness. Others are underresponsive, also known as hyposensitive. Examples of this are certain texture preferences, for example, rubbing a wall or rubbing the carpet because they like the texture, or incapability to wear certain clothes due to their texture, like, for example, red dye, or just itchy clothing, like costumes. They may be unable to be in a room with normal lighting, or irritated by loud noises such as a fire alarm in school. Hyposensitivity can lead to unresponsiveness, such as to sound, for example, when their name is called, not noticing certain smells or objects to sight, etc. Sleep dysfunction. This issue is one of the most common among people with autism. This can mean that autistic people may have trouble falling asleep, staying asleep, or sleeping on a normal schedule, such as sleeping during the day instead of sleeping at night and staying awake at night. Therapy, sleeping aids, and medication can be used to fix the problem. Pica is the tendency to eat things that are not food. While this remains normally for children 18 to 24 months, autistic infants may hang on to this trait a bit longer, but this normally does not exceed the age of 3 to 4 years, and even getting to 3 to 4 years is pretty uncommon. And I think that's it. Thank you for watching this PowerPoint.